Webinar will be recorded, hopefully for future training purposes, so that people can not have to get on a training like this, but can just watch the videos. Just so everybody knows, I am recording this right now. Please remember to mute your phones or your microphones when you're not asking a question, so that we don't get any feedback or anything like that. My name is Andy Tyler. I'm the regional epidemiologist here for the Northwest region, housed in Mesa County. I've done several CEDRS trainings before. I can see folks are kind of from all over the state, so that's good. A lot of Northwest signing in right now. So can everybody see my screen? It should be the training, the CEDRS training website. Somebody could say yes or no into the chat box, or that'd be ideal. Okay, thank you, Carrie. Hey, there we go. Good. So this is the homepage of CEDRS. CEDRS is an acronym for the Colorado Electronic Disease Reporting System. And if you forget what it stands for, you can always see it in the top left here on your screen. It's a secure web-based database system used to collect public health reportable disease case information. Public health primarily uses CEDRS, but so do hospitals, especially infection preventionists, and other healthcare providers and laboratorians also, I think, use CEDRS a fair amount as well. So how did I get to this page? And as I'm going, if any of you guys have any questions, feel free to jump into the call and ask. I'm happy to explain how I got somewhere or what I did. So I'm just going to show you. So this is the E4, this is the login page. And from here, it will bring you to a screen that looks like this. However, a lot of you probably don't have this many options to go into, which kind of makes it easier. So typically, in the real world, you will go to CEDRS 3 production. This is new CEDRS with real data. That's where you will be entering real cases. For today's purposes, and if you are just wanting to kind of feel your way around CEDRS, I recommend going to the CEDRS training website. This is full of pretend dummy information. It doesn't go into the real system. That's what we're going to be using so that when I do some case entries today, I don't have the state calling me up asking me why I'm reporting a measles case, for instance, when I wasn't trying to be. So this is the home screen. This is more useful for local public health than it is for hospitals, but I think it's good to be familiar with it. So we have a couple of different options here. We have open events and then recent events. So the open events are all cases that have been reported that have not been investigated, have not been closed out. And so you can see I clicked this little drop down here and it opened up a lot of them. Because this is the training website, there are a lot of them that have been entered. Oh, I'm sorry. Yes? You have a question? No? Okay. Please remember to mute your phones if you're not asking questions. So this is what is open right now, but that wouldn't show everybody. Say you investigate an E. coli or someone else, something like that, and you close it. It won't appear in the open for my agency anymore, but it will still appear in the recent agency events if it is within the last 31 days anyways. Otherwise, you'll have to search for it, which we'll go over later, how you search for things. So we have open events and recent agency events. For most of your counties, what is open for my agency is probably the most useful drop down. For me as the regional epi with 16 counties that I have reporting, the what's open for my agency isn't quite as helpful to me, but it is for other people. The other thing I want to point out here is that hospitalized flu cases and hepatitis C cases are not automatically included in these lists. And the reason for that is a lot of the counties in the state during flu season especially would just be kind of overwhelmed with hospitalized flu cases. So if you want to see those flu cases, however, you just click on that and you click refresh query, and I had put in a flu case, so you can see how it now populated with another flu case entered. And then the same thing goes for hepatitis C, and then if you want to get rid of, and I had a hepatitis C case as well, and then if you want to get rid of those, you unclick them and you press refresh query and they disappear. So that's the home screen for the cases anyways. We have up here in the top left a number of different options, and we're going to go through each of these during this training. The home page is, of course, what we're on, the home page. We have our search function for cases. We'll go over that later. A new event, which we're going to talk about next when you're reporting a new case. Line lists, if this is probably more useful for local public health agencies than hospitals, but not necessarily. I do know one infection preventionist who likes to use these. Line lists, reports, there's a number of reports that we're going to talk about near the end of the training and how they are useful. The CEDRS has an internal messaging, so say you don't want to be using your email, or you don't know somebody's email, you can find them typically through CEDRS contact directory within here if they're in CEDRS, and then there are a number of resources that we'll talk about as well. So before I move on, does anybody have any questions on the home screen? It doesn't sound like it. Perfect. So we'll move on to probably the most important, at least the most used part of CEDRS in my opinion, the reporting a new event. So when we're reporting a new event, this is not necessarily a new person, because people can be in CEDRS, but it's a new reportable condition that they have. And so my example of this is somebody might already be in CEDRS for something like a hospitalized flu case or a hepatitis C chronic. And then later they're diagnosed with salmonella or Giardia, something like that. So they're already in CEDRS, but they're not in CEDRS with that new diagnosis. And so that's what we're going to be kind of focusing on here. So what you do is you would type in their name, as much information as you can. The boxes that have the red asterisk means that they are required fields. The boxes with the red pluses means that they are important and highly suggested that you fill them out fields, I guess, is how I would describe them. So, whoops, my numbers are not on. There we go. So I'm going to fill this out, and so I typed in a birth date. You can also click on the calendar, and it gives you a calendar for you to be able to click on the date if you would like to do that as well. Then the diagnosis, this part is very important. I hadn't thought about what I'm going to give Wally Washington. We'll give Wally malaria. So then what you do is you search for duplicates. And we'll see. So CEDRS went through and it searched in its whole database for anything that matched the first name, the combination of the first name, last name, and the date of birth. So you can see here that it is showing no duplicate profiles. So Wally Washington was not sick with hospitalized flu a couple years ago or something like that. So we're going to create a new profile. After I do this, I'm going to show what it looks like when there is a duplicate profile. So we're creating the profile now. So we're not doing anything with the disease yet. We're just saying, who this person is, much like kind of lamely, kind of like a Facebook profile, I guess, is how I imagine it. So, you put in the address. We'll say that this guy lives in Grand Junction, Colorado, 81505. You can go through this, and again, as I said, these have the red pluses, meaning that they're not required, but obviously it's much better if we do have the address, especially the county. The county is obviously the most important part because that really determines who is able to see this profile and who is going to be doing the follow-up. A phone number, obviously useful in the follow-up, and so let me just type in something here. And sex, again, not necessary, but useful. It doesn't always, we don't always have this, especially with medical records, so this can be left blank, and then local public health will ask this when we're doing the investigation. So I've typed in all of this information. One of the great things about new CEDRS, and it's not so new anymore, but CEDRS anyways, is that it has the ability to validate these addresses. So when you're putting in an address, I always will click validate address. And now you see here, this was what I entered, and this is what CEDRS thinks the address is. So you see the difference here is that it changed the zip code to be the accurate zip code. If I would have put in the wrong county, it would correct the county and the city and that sort of thing. So always important to validate the address, because then it geocodes the address, and apparently there is a 111 Main Street. So okay, we've got all that information. I clicked next down below. Now the next step, this is where we get into the disease-specific information. And this is a part that I'm going to just focus on for a second, because it's not entirely intuitive, but it is important to make sure. So typically with most reportable conditions, we're going to have a lab test that goes along with it. So the first thing you do up here in the top left of the box of the lab is add a new specimen. And so it creates this box for you, and you go through. So for malaria, it'd probably be a blood test. Collection date, again, not required, but certainly recommended. And the testing lab, and hopefully you'd have all of this information available, which makes this go by pretty quick. So we'll say St. Mary's did this test, and we'll save that. This is the part that is not entirely intuitive. So right now, all that we have entered is that we did a blood test on this date at St. Mary's, but we don't know what the test was or if it was positive or negative. And so we have to then add a new test underneath the new specimen. And this is a part that, once you get it, it's easy to remember, but it's something that is pretty commonly missed, especially for beginner CEDRS users. So we're adding a new test. We can see, we'll say that this was a PCR, and it was positive. And if you have the result value and reference range, you can enter those, although that's not necessary for most conditions. Some of them it is necessary for. We'll say the result date was the 17th, and we'll save. So now we can see that we did a PCR test on a blood sample on the 16th, resulting on the 17th. Just important to remember to do that, add a new test. And say you've done more than one test on the same specimen, then you add another test, and it will just continue on, or add a new specimen. Same thing with providers. Very helpful to enter a provider. So again, just like you'd add a new test, you click add new provider, add new record, and you can fill out what sort of provider it is. That, especially for local public health, it's very helpful to have this provider information so that we can reach out to the provider, find out if the patient has been informed of their diagnosis, find out any additional information. Just makes that easier. I'm going to not put in any information so that you guys can see a warning label that will appear when I don't put anything in here. And then hospitalization, same thing. Were they hospitalized? Yes or no? Add the record of where they were hospitalized. We'll say St. Mary's again. When they were hospitalized, 15th to the 17th, and if they're not discharged yet, obviously leave the discharge date blank. So then we can see this. So we've entered everything on this, except for, as I said, I did not enter a provider, because if I try to now report this event, CEDRS will ask you, do you want to enter a provider? I want to enter information, or do you want to proceed anyway? And so sometimes it can happen where you don't know who the provider is, so you'd want to proceed anyway. If you do know who the provider was, it's helpful to put it in there. We're going to proceed anyway. So we have now reported a case, and it brings us to the event page of this case, the event being a malaria diagnosis. You can see here now there's onset date, which county is it assigned to. You can also see that up here. It has their birth date, sex and county, and the profile ID and the event ID. And so, as I discussed earlier, it's important to know the distinction between profile and event. One person can obviously get sick with more than one thing over the course of several years. So their profile will remain the same. It might get updated with new address, new phone number, perhaps a change in name, but the events will change. And this is where we get a lot of duplicate profiles of people who are already in CEDRS, and we have to merge them. And so it's just important to remember that we add new events to the same profile page. So this is and I'm going to talk about in a bit, if there is a duplicate profile, how CEDRS will alert you to that so that you don't go through the trouble of entering all the profile information in when you don't have to. So this is the event page. We can see the address, the diagnosis details. So down below here, we have a couple things. When we're doing the investigation, it is important to go into case investigation. If you are, say you're part of Mesa County Public Health or whatever county you're part of, you want to assign yourself to that. Renee, that's funny. You want to assign yourself to the case so that other people, and then you'd want to hit save, so that other people who can see this case will see that you have assigned yourself to this, you are working on it. Typically, you want to change that investigation status to in progress as well. And the reason for that is, if I, as the regional epi, am looking through cases and I see a case that's 2 days old or 3 days old, and it still says newly reported and there's no person assigned to it, I'm going to assume that your county has not seen the case. And that's not a negative thing necessarily. I check CEDRS a lot more often than some of our smaller counties do. So, you know, I'll probably email you or call you saying, hey, I see you have a Giardia or something in there that you need to take care of. And so we can, if you are working on it, by doing this, that'll let people know. Another very important thing in this case investigation window is the contact attempts. This is something that is very important to get filled out because it really documents our work on these cases. It can be challenging in public health for us to quantify our work and our impact. You know, how many people do we prevent from getting sick is hard to quantify. But this sort of thing we can quantify. How long, how often are we trying to contact these people? How long is it taking? You know, what sort of work are we putting into the follow-up? So it's very important when you are trying to contact these folks to be filling out this contact attempt box. Typically, it'll be a phone call or a letter if you're not able to get a hold of them. You know, phone, usually it's message left, although it can be interview completed, and then you say what day you tried to talk to them. And then when you do successfully, hopefully, get a hold of them, you say phone, interview completed. Make sure that's input in there. And now we can see that, hey, I tried once on yesterday, whatever, Tuesday, was unsuccessful, and then Wednesday was successful. So that's case investigation. The provider box, if we had entered the provider information, this is where it would be. Otherwise, we can always enter more or new information. And then event notes. And this is the other important information to know. So we have the event notes page. And then if you go to the profile page, there's also a box for notes. It will be very rare that you will be entering profile notes. Most notes will be going into the events case notes page, and I think that makes sense. It's notes specific to the reportable condition and not their profile overall. So entering a note, I am entering one of the things that is important to know is in CEDRS now, we have a spell check function, which is very useful, especially when you go through and enter a very long note. And the reason it is useful is once you click insert, there is no way to edit this case note. And so if there's something spelled wrong that you didn't want spelled wrong, or you had, you know, more information, once you have entered the note, there is no way to edit it. It can get deleted if you ask CDPH eyedropper, their new acronym, FIRE to delete it, but otherwise it's pretty permanent. So just keep that in mind as you're entering the notes, that there's no way to edit them. Hospitalization. So that is part one of entering a new case into CEDRS. I'm now going to show what it looks like when you are trying to enter a case with somebody who has a profile page already in CEDRS. Does anybody have any questions on this before I show you what it looks like when you enter a duplicate profile?
No.
Okay. All right, well then we'll try again. So, So we're going to enter okay, no, I do remember. So we're going to enter Wally Washington again, now that he's in there, with a new diagnosis. This time he's been sick with hepatitis A, unfortunately. So now we're going to search for duplicates again. And now you can see a new window has popped up. Suspected duplicate profile. Do not click create profile if the person you're searching for is listed in the search results. First, try to see if this event is already reported. Otherwise, it might not be the same event, because sometimes the laboratory can get it reported electronically faster than we get it, and then somebody else tries to report it and it's already been entered. So that's important to look. But otherwise, you can see that the profile is already new. Say the person, as I said, was hospitalized with flu before. So as it said, do not click create profile yet. What you want to do is you want to try and see if this is the same Wally Washington. Now, a lot of times it will be pretty obvious right away. If it's the same name, same date of birth, and same county, it's likely the same person, although that's not 100%. But there are ways you can check that. So you can click from this window, you can click on the profile ID. And from here, you can see that, okay, this is Wally Washington, and oh yeah, this was his address. So that this is not the person I want. Let's see if this is going to work. It's going to bring me back. Dang it. The other way you can do that, I thought it would bring me back to the page I was on, but it didn't. The other way you can see if you don't want to go into the profile page is you can click on the event, and it shows here over on the right what the event is. And so say you were trying to enter the malaria, you say, okay, it's already been entered, I don't need to enter it. If that's not the event that you're looking for, as I said, you can click on the profile ID, make sure it's the right person, and it is in this case, and then you would just click next. And so that way you don't have to enter all the new profile information, but it's a new event, and then you go into this, what we just covered, where you enter the lab, the provider, the hospitalization, and it will, again, bring you to the event page. And now you can see here that it's the same profile, but on the event page, we can see that there are two different events that are entered into CEDRS. Now, one of the challenges with this is if the person was entered into CEDRS with an address that is outside of your county or of your sharing rights. So say this was a Mesa County resident, but 5 years ago he was put into CEDRS in a Jefferson County address. It will not allow you to view the event. It will not allow you to view the event. So in that case, typically I would recommend calling, if you're local, call your regional epidemiologist, or call the state to try to get them to look at it to see if it's the same person, is my recommendation on that. So, and then the last thing I want to show you guys is what it looks like when you're trying to enter a 24-hour reportable. So we'll give me something bad here. So I'm going to have a foodborne botulism. Going to look for duplicates, which there are none. So, okay, because this is a 24-hour reportable, we're trying to create the profile, is now giving you a window saying, hey, after you enter this case, you need to report this case to the 2700 on-call number or the after-hours number, or to your regional epidemiologist, whoever you think you should call first. But it should be reported. Just when they're the 24-hour reportables, it is important to not just put them into CEDRS, but to actually tell somebody about the diagnosis as well. But I'm not going to go through and enter that in. You can see that. So that is how you enter a new case into CEDRS. And that's, I would say, one of the main functions of CEDRS. Does anybody have any questions on anything I just went over in regards to entering a new case into CEDRS? Good. I must be doing a bang-up job explaining this then with no questions. So now you can see here on the home page, those new cases that I entered, the malaria, hepatitis A, have now populated onto the home page as well. So we can see, you can see those once you've entered them. So the next thing I'm going to show you is how to properly close out a case. Once you have investigated it and you need to get, rather than have it be a newly reported case, you need to have it be, you need to close it out. So let's see, I've shown you guys how to properly enter the lab specimens, the labs and the tests and the specimens. So we'd enter a new specimen, then you enter a new test that goes along with that specimen. You want to make sure you enter the provider information, and then you look at it. Before you do the investigation, you want to make sure you call the provider, make sure they've informed the case of their diagnosis. Makes the interview a lot easier when they already know about it. And then you go into the surveillance form. And so this is a very important part of the case investigation, because this is where we document, again, our work. So you want to make sure you get the demographics filled out. This is one of the metrics that the state uses as part of our completeness reports, is looking at the race and ethnicity. So on all cases, it is important to at least attempt to get that information. Otherwise, filling it out as unknown or refused. And then getting their symptoms. So this is the salmonella case form. So they all look slightly different, obviously. But going through, you fill out this as from what you asked the case. I still print out the paper forms when I'm going to do these investigations, and I do it by hand. I know other people just go into the surveillance form, and while you have them on the phone, they just fill this out. Either way works, whatever you find easier for you. Typically, they don't answer your questions in a very linear way, so I find the paper copy to be easier because it's easier to keep up with them when they kind of answer their own questions. So you would go through this, you would answer all of these questions, and this is the same for all of the surveillance forms. And then here at the bottom, you want to make sure on investigation status, once you have completed everything in the investigation, that you change this to investigation completed. That way, on the home page, it will show that the case is closed out or that it has been investigated. And then, of course, you want to enter your case notes in here as well and make sure you hit save. But now you can see when I go to case investigation, the investigation status has changed to closed rather than newly reported. So now when I'm on the home page and I open this up, you can see that the salmonella case is closed, which indicates to me that somebody has investigated it and followed up on it. The other thing to note on this surveillance form, and those who have used CEDRS a fair amount who are on the call can attest to this, CEDRS has a very fast timeout or like lockout timer. So say you're doing the surveillance form and you get a call, and that call takes you about 5 minutes to answer, and then you go back to this form. CEDRS will have likely kicked you out. And so anything that you have not clicked save on will not be saved. And so take it from me, click save a lot as you go through this to save yourself the headache of having to re-enter all of this information if, say, you are called away for even a couple of minutes. CEDRS has a way of kicking you out and making you redo everything. So just make sure you're clicking save as you go through this so that you don't have to waste your time re-entering information that you already entered.
Hey, Andy, can I ask you a question?
Please.
When you said you print out the copies when you're going to do your surveillance or your investigation, how do you do that? Is there anything special we need to know about how to print those out from there?
That's a very good question. So when I say I print out the forms, what I mean is I go to the Communicable Disease Manual, and I'm glad you asked the question right now because it's easy for me to show you. So on the Resources tab here, you can go to the Communicable Disease Manual, and from there, it has most of the disease investigation forms, the ones that you'd have to use. So this is where I get them. And so for salmonella, for instance, I go down to salmonella. I go to the case investigation form, and then I just print this form out, and I fill it out by hand. And then from there, after I've completed the interview, I go into the surveillance form and I enter whatever is on this form into here. The state has worked really hard on getting the online CEDRS surveillance form to match what is on the paper form, but it is not a perfect match all the time. The one that I'll point out, I don't know all of them that are not a perfect match, but the Campylobacter, if you are not in the FoodNet counties, which none of the Northwest or West region counties are in this, the Campylobacter form is a lot shorter than the form that is on CEDRS. And so I've gotten questions on, hey, I've done this form and then I go into CEDRS and there are a lot more questions that I don't have answers to. And when that happens, you can just leave them blank. You can just leave them in the please select category. So that's what I mean by by getting the paper form and using the paper form.
Great, thank you.
And then what I do to follow up on that, when I have the paper form, because if a case is linked to a wider outbreak, the state will ask for the paper interview form that you filled out, if you filled one out anyways. And so what I do is once I fill out the paper form, I will scan and scan it to myself. And then you go into the documents page and you upload that scanned paper form into CEDRS. So you choose the file and then you click upload file, and then a file PDF would display here. And so I highly encourage you to do that in case a case you investigate turns out to be linked to a wider outbreak. That way you don't have to be holding on to any paper forms. The state can easily access the paper form, that sort of thing. As it says, do not upload full medical records. You can upload medical records that are pertinent to the investigation, but don't upload full medical records and then try to name it, something that is obvious as it instructs there. So that's how I do that. Let me see here. Once I have completed my entire investigation, we don't do this where I work, but some agencies like to have paper copies of the full form, or if, say, somebody asked for their CEDRS record, that hasn't happened to me yet, but certainly could be possible. What you would do is you go to Event Print. Once it loads, hopefully. Oh, well, it probably isn't available on the training website. On the real website, if you go to Event Print, it will bring you to a page that you can select. It gives you the option of just doing like the event page or the surveillance form or the labs, or you can select all, and it will allow you to download it as a PDF where you can print it off or save it, that sort of thing. So that's what you do with Event Print. And if you have questions on that, I'm happy to walk anybody through that as we go through it. And then how I got to this page is I clicked on the sharing tab. The sharing tab is just important to know about because it shows you which agencies can see the case that you're currently looking at. Recently, I've been investigating an outbreak that spans across multiple counties. And so those cases that aren't in my service county, the other regional epidemiologist has shared this specific case with me so that I can look at it, even though I can't see the rest of those county cases. So that's how you do that on this page. You select which agency you want to share it with, why they need to know about it, which you can see here. And then if you just click save, it'll add the new one to it for access rights. So that is how you properly complete a surveillance form. Really, when you're done with the investigation, you just want to make sure that this investigation status is closed. You've entered whatever pertinent information you need in the notes section, and that the surveillance form is properly filled out. And as I said, I can't forget it, I said it was very important, and that you've entered your contact attempts so that we can keep track of that sort of thing in public health. That is, that's really the bulk of working on a specific case investigation. Does anybody have any questions on that, on what I just covered with where you should go for a case investigation? Okay, so I'll move on. I briefly touched on this earlier, but again, this homepage is where, especially for the locals, where you can see what's open for your agency. I think it's important to check on this window, and then if you want to check on things that have been closed out or just how many cases over the past 31 days, you would click on this one down here over the week or what have you, and you can see them all listed out for your, likely for your county, but if you have sharing rights with other counties as well, you'll be able to see those cases too. So that is how you do that. Say you know of a case that you want to take a look at the event page, but it's out of the 31 days, so they don't appear on this list. What you have to do is you have to use the search function up here at the top of CEDRS. If you know the event ID, that's ideal, and you can give some echo. Oops. So if you know the event ID, you can put it up here in the event ID and it'll bring you right to that event ID page. Otherwise, the profile ID is the same. If you don't know either of those things, that's okay, because if you know the last name and the date of birth especially, even if you don't know the county or the case, this search function is very powerful. I've been able to find cases where I didn't know, all I had was the last name and the date of birth. I didn't even know the county, and it's able to find it for you. So you should have pretty good luck as long as you have some bit of information on the case with being able to find it using the search function. So that is everything on entering a case, investigating a case, closing out a case, and finding a specific case in CEDRS. Now I'm going to transition to using the report functions that CEDRS has built into it. Before I do that, anybody have any questions on anything I've discussed? Perfect. So the first one I'm going to talk about is line lists. And so this one is, as it says, is about a line list. It'll pull a list of cases by what you want to look at. So first, you have to create your own query. The first step is the criteria. And the criteria is, I can't see with the GoToMeeting in front of it. The criteria is any of these options. So typically, you might be looking at a disease. And so that disease is either equals, or if you want to look at more than one disease, perhaps E. coli and salmonella, that sort of thing, you would click is one of. So I'll do is one of, and then you go through here. So if I go down all the way, lots of diseases in CEDRS now. Salmonella, and then to click more than one, of course, you have to hold the control key on your keyboard, and you can click another one. You can click more, and if you click them again, they'll go away. You can drag around, whatever you want to do. So I have salmonella and E. coli on here. So I would add these criteria to my list. So you can see over here. Well, next, of course, I want to know probably what county I'm looking at. So we could say, who did I enter those into? Maybe Eagle. I think I had one in Eagle. You would click a county, and again, you can choose more than one county if you would like. For the line list function, you're only going to be able to see cases that have been shared with you, because this does include protected health information. So you're not just going to be able to look up Tri-County and see all of their, hepatitis cases, something like that, unless you have those shared with you already. So we have Eagle, we have Salmonella, and then we probably want to know when was it since the last time? So we'll just do, we would say since the start of the year. One thing I'll point out is the expression is greater than, is equal to a date if you're looking for a specific date, or less than a date, or you can do between two dates. But the reason I'm pointing this out is this is not greater than or equal to, it is just greater than. So to start at the beginning of the year, you want to put in 12/31 because that will then capture 1/1. Whereas if you just put in 1/1 2019, it will start your range on 1/2, which probably isn't a big deal for that, but for sometimes that could be you could miss some cases. So again, you can look at these. So those are our criteria. And then on the line list, now we get to choose what we want to see. So typically I would do, first name, last name, perhaps sex, maybe ethnicity, what is their event ID, how old are they, the investigation status is one that Tom Orr and myself use quite a bit to kind of look and see if there's any cases of, say, pertussis or something that haven't been investigated that we missed. Address, you can click on city, county, and you'll load those fields, and you can see all of them. Now all the fields that we'll be able to see on our line list, you can sort by A to Z, Z to A on these various fields. And so, okay, we have our line list, we're happy, we want to see what it says. Then you click View Results, and we'll see if I guessed any. Nope. If there was a case, it would show up here. I wish I could remember what. It's Mesa. County. Mesa. Let's see. Is it going to work now? Fingers crossed. Yes. Okay. Yes. Our Johnny Smith. So here we can see on the line list the events, the last name, first name. This is everything we wanted to see. You can download this line list into Excel by going here and then clicking on the Excel button, and it will create an Excel sheet for you so that you can play around with it further. That's what I typically do, especially when you're wanting to want to sort anything. Okay, so this is our line list. This is our query. We really like this query. We're going to use this query all the time, and I don't want to have to remake it. Whoops. Shoot. I don't want to have to remake this query every time I use it. So we have the ability to save these line list queries. So you'd say save query as salmonella test. And now this query and all those criterion fields have been saved, and you can see the saved queries up top. You would click on it, click Run My Saved Query, and it will do this for you. And then you can do that over and over. To delete a query, you have to highlight it and then press delete for it to get deleted. And it didn't do it, but that's how you do it. I'm not sure why it's not deleting right now. And from here, you can then go into, I clicked on them with the mouse onto this to get it to open, but you can go into all of the events from the line list. So it's a pretty useful page. One thing you'll notice on the line list that it does not include is any laboratory information. That is for complicated database reasons that I don't really understand, but in our next reports function, I'll show you how you can get that laboratory information to be able to view it. So that is a line list, and then of course once you've made it, you can go back and change your fields if you want. You can get rid of ones, add new ones in, and of course save it and for future use if you want. So that's a line list and how to use them and how to export them onto Excel. You can see here. One thing that I'll point out through error that I've had is I purposefully clicked on the event ID expression here. And the reason for that is when you export it, the event link exports as this unusable series of code. You have to have the separate event ID for you to be able to see what that event ID is once you export it into Excel. So that's a pretty minor thing, but if you use line lists, it can be a little frustrating. That's how you get around it. So does anybody have any questions on what I've shown you on line lists, or anybody have any examples of how they've used it, how they like to use it. I use it a fair amount, but I don't know how often other people do. Okay, doesn't sound like it. All right, we'll go. So that's everything. This is line lists. And the only thing you can do, of course, is create line lists, which makes sense. The next thing we're going to talk about is the reporting function. So here, when I clicked on reports up at the top, it gives you all of these options that you're able to use. So the first one I'm going to talk about is creating a crosstab. And so the crosstab, I really like the crosstab function because unlike the line list function, you are able to see case counts from other counties that you don't have sharing rights with. So say your Route County or Eagle County, you want to compare your amount of cases of whatever to say Pueblo County, something like that. You are able to do that. You just can't see any of the identifying information. You can just see raw case counts. So that's a thing that I find pretty useful. The crosstab function here, for those of you that receive the weekly CEDRS report that Tom and I send out, this is how we pull those numbers, is through the crosstab function. So we have a row option here. I'll do county for that, and we'll see what comes up. And then the columns option has a number of them: age group, diagnosis. I'm going to do report month for this. Let's see. I am going to choose a couple things here. We'll do hepatitis A. I don't know what's in the training website. What have I put in? Pertussis, meningococcal. I know I put in an E. coli and a salmonella. So you just leave those highlighted. You can choose which counties you want to look at. So, well, I don't know how many of these have any information in them, but oops. So I'm doing the West and Northwest regions right now. So over here in the report date, you can choose report date, onset date, collection date. And these are, for various things, these can be useful. For something like influenza, I always go with collection date because that's obviously a much more accurate representation of when the person was sick than was the report date, because sometimes that can be delayed, but the collection date is obviously they're getting tested for flu when they're sick. But for overall, typically collection date, or report date, excuse me, is a fine thing to use. What is the date today? 17th, so 2019. And again, just like when we were entering the case, we have a calendar option here where we can just choose what date we want to use. You can choose whether or not you want it to be, if you leave this blank, it will grab all of these options. If you just want confirmed and probable, you can drag and click, or else use the control button to highlight them. I don't usually do the age and sex for things, but that might be something you want to look at. Show the criteria. You can, here is where you limit to sharing rights. So if you don't want to have to choose your counties, and you just know the counties you want sharing rights with, you would say yes to this, and then it would just show you. Sorry, Joan, I didn't see your question there. I saw your answer to it, though. If you have another question on that, I'm happy to answer that if you don't feel fully satisfied with your answer. So we have our columns and our rows, and we'll include the row totals. We have our report date, and then we will view the results. Oh, shoot. So the training website does not have all of the capabilities that the live website does. I wonder why it's not showing. What if we is it going to show? No, it's not going to let us out. Well, on the real website, if you do play around with the crosstab, which I do encourage you to do, because I think you can get very good information on case counts and kind of incidence rate, that sort of thing. It would just show you basically what is pulled up here. The rows would go by the counties, so the counties that we have selected, and then the columns would be January through July at this point, and it would give you the numbers for each of these diseases that we have entered. So if you try this and you have a question on it, again, feel free to email me or call me. I'm happy to go through this with you and work on it so that you can get a crosstab or a line list that is useful to your agency. Does anybody have any questions on the crosstab? I wish I could get it to show you what one actually looks like, but I think most of you probably have an idea of what a crosstab report would look like. As I said, I find them pretty helpful. So that's the crosstab report. The other one that I use fairly frequently is the enteric cluster detection. And oh, shoot, it's not going to show me, dang it. The enteric cluster detection it has a lot of the same options as the crosstab, but it's only the enteric diseases. So like the hepatitis A, salmonella, E. coli, Giardia, crypto, and I could go, the list goes on, unfortunately. But what this report does, this is where if you are interested in seeing the laboratory testing data, this enteric cluster detection report, that's the report you want to use. Because what that one will do is it will pull a line list of those cases in your county of say it be salmonella or E. coli. You can only do one disease at a time. And then it shows their name, their age, some other information, address, that sort of thing, but then it goes into their lab testing data. And that's where you can really look at, okay, what tests were positive? Was it a PCR at a clinical lab? Did it get sent to the state lab? Was the state culture for it positive? What was the PFGE pattern on that? So you can see if there's any matches in your county. I believe it will show the whole genome sequencing number at some point. Don't ask me to dive further into that at this point because I'm not sure what it's going to say exactly, but I believe it will give you, once the state really gets the whole genome sequencing up and running and we move away from PFGE patterns, it will give those as well. So that's where, especially for the enteric diseases, I encourage you to look if you want to look at the lab testing data. It's a very useful tool. But all of these are useful tools depending on your incidence of these diseases in your counties. The listing of hospitalized flu cases is a very useful one. This is one I use during flu season regularly to look at all of the counties in my service region and see what's going on there. The pertussis listing, if you're in the middle of a pertussis outbreak, can obviously be very useful. Same thing with the West Nile one. So I'm not going to go through each and all of these, but I do encourage you guys to take a look at them just to see if they're there. As I said, some of them are going to be more useful than others. Luckily, like the measles and the rubella and the mumps listings, we don't have to use too often, fingers crossed, knock on wood, that they're staying down. And then animal bite listing might also be very useful for some of your counties. Let's see. Another one that was thrown in, I believe counties like Garfield, Pitkin, and Eagle County, I believe, have some sharing rights with each other's cases. And so this was a report that was put in at my request for counties like that who, where there is importance in seeing what other counties' cases are what is happening in other counties, I should say. And so this one is where you can see that list of those other cases. And of course, because it's the training website, we can't go into it, but that's another one that might be useful to you guys. So let's see. Those are a lot of the canned reports that I'm really glad they have worked hard to get into CEDRS and the crosstab. Let's see. Does anybody have any questions on any of the reports? Probably not too many questions because I can't really go into any of them. But if you do have questions, feel free to reach out to me so that we can get those answered, get them useful for you, because CEDRS is pretty dang powerful on this front end, and I think the more we are able to use it and familiarize ourselves with it, the better off we are as kind of a public health network. So that's reports and line lists. Those are the two ways that you can really pull the data back out of CEDRS. And both of them, I wasn't able to go into it, but all of these reports you are able to export into an Excel spreadsheet. And there might be other ways you can export it as well. The Excel export is the one I'm most familiar with. But just so you know, just like with the line list, there will show an Excel button that you can click on to export it. So that is, we've gone over the home page, we've done searching for cases, we've entered new events, we've run our reports. So next on the list is the messaging system, and fingers crossed that this works decently well on the training website. I might go into the real one if it doesn't. Let me see here. So this is the message page, the inbox. Obviously, they created it to look a lot like an email inbox because that's really kind of what it is. It's just email within CEDRS rather than somewhere else. So say you want to email somebody, you would click new. If you have an unread message, there will be a red, I want to say it's an exclamation point. I can't remember exactly what, or like the number 1. There will be something that's red here next to the messages that indicates that you have a new unread message. And a lot of times those messages are from like Alicia Cronquist at CDPHE or somebody else at CDPHE sending out kind of a group-wide message saying, you know, something new has been added to the CEDRS disease list, our Board of Health rule changes, that sort of thing. But you can get messages from other agencies as well. That's a lot of them I get this way. So if you do see that red, I want to say it's an exclamation point, but I can't remember for sure. Take a look and make sure you don't have any important unread messages. If you want to send a message, you would obviously click new. And then here on the 2, this is where I'm unsure if there's going to be, oh, hey, great. So when you click 2, you can go through and you can find through the list the CEDRS user that you want to email. This is a very nice and powerful tool that I'm really glad they have entered because this communicate with agents might not otherwise it might have to call them to get their. So now Alicia Cronquist, and just like you would, you can type up your email. Typically it's, a lot of times this is going to be about a CEDRS case, so I would recommend putting in the subject line the disease and the event ID number so that it's easy for them to look up and know who you're talking about, if that is indeed what you're sending it about. And then, much like you would in an email, you hit send and it goes through. And that is the CEDRS messaging system. I'm glad that I was able to do the address book this time. It wasn't before. So really straightforward. It's a lot like your normal email. I think that makes sense to everybody. Does anybody have any questions on the CEDRS messaging at this point? I don't. I won't be surprised. So, no. That's good. So that is everything on CEDRS itself. Is there any, before I talk about the resources page, is there anything that anybody who might have come on late would like a quick explanation, or does anybody have any questions before I move on to the resources and the training pages, which are also very useful when you're using CEDRS? So.
Andy, how long does it take once you close a case for it to update? Is it immediately that it shows as the case was closed?
Oh, that's a good question. It depends on the type of disease. Most of them will immediately close. Okay. Some of them, like pertussis cases, have to get reviewed and closed by the pertussis epi tie at CDPHE. Okay. So on those, it will, right where my mouse is, instead of saying closed, it would say investigation completed. And, okay. and that way you then know that it needs to get reviewed typically by CDPHE before they get closed. Pertussis is one of them. I know there are others. They're not jumping out to me. Meningococcal disease is probably another one because of the pertussis outbreaks I've dealt with. That's the one that springs to mind. But yes, but for most diseases, when you click investigation completed, it will automatically change it to closed right then and there.
Okay, great. Thanks.
Thanks for asking that. That's a good question. So, okay. So the next thing that really the last thing that I want to talk about is just the resources page. So here, you know, you can go to the home page, of course, the top one. I don't typically use that one. As we talked about, the Communicable Disease Manual link is an important one to know. This is where you can get the investigation forms. You can look at the page. You can look at the page on the specific disease. Typically, when I'm going to do an investigate or call somebody and do an interview, I pull up the page on the disease so that I don't obviously have to have it memorized. And then when they ask, hey, how long does this take me to get sick? I can look and say, hey, well, the average incubation period is 7 days. And so I usually just have this page pulled up as I'm doing the interview. It's also very helpful for, crypto probably does have it. It's also very helpful for if they, oh goodness, let me get to it. If they have a special situation, typically food handler, childcare, that sort of thing, you can make sure. I usually review this before I get the person on the phone, just so that I know if, hey, they say, yes, I work at Taco Bell as a food handler, I know what to recommend to them. Same with childcare and school and healthcare providers. So, and then environmental measures too. This one is helpful because it tells you, what you need to do next if you do suspect it's environmental measures, or if they ask you questions about how do I protect myself? Should I go swimming? That sort of thing. No, with crypto, don't go swimming. So that is, whoops, I clicked on the wrong thing. So the Communicable Disease Manual, and that's how you get there. Otherwise, you can Google Colorado Communicable Disease Manual, and it'll take you right to that. The CDPHE and regional contact info is another very useful contact page when it loads. Hey, there we go. So it has the field EPIs, which would be Kate Lujan here on the western slope. Otherwise, actually, hey, this needs to get updated. This is probably just out of date from on the training website. I think this has been updated since Bill retired in general. Take a look at this. I have one of these saved onto my desktop too, but that's not necessary. But you can see who at the state, say you have a hepatitis question or a flu question. Yeah, the one on the training website hasn't been updated in a while. So look at the active site one if you want to get the real information. And then it also has the regional epidemiologist information. So for Tom, for me, that sort of thing. So you can get all that information if you need to get a hold of anybody. So that is the regional contact info. Guidance on CEDRS records release. I'm not sure why that's not pulling up. I don't know if that's a problem. I'm going to take a look at that on the regular website. But, obviously, usually a good idea to reach out to state or regional epidemiologists before you're releasing any records release, just to make sure we're doing it right. I always reach out to CDPHE before I do that. I don't know what this one is. Case reporting guidance. Okay. Say you need to report a case and you can't remember every lovely piece of information that I have given you today on this training. The CEDRS reporting guidance goes step by step through how to report that event like what we went through. So this is a pretty useful page. It tells you exactly what you need to do, who you should contact, that sort of thing. The new CEDRS training website, which is not to be confused with the new CEDRS training, portal, but the new CEDRS training website is this, where they do have a lot of useful information, documents of what's new, how you do certain things, how you run reports and line lists, they have videos on how to enter. This is where I'm hoping that this webinar training will be housed so that people can go and look at it again. But so this is a good page too if you're needing to find something else out. Otherwise, as I said, feel free to ask me. I'm happy to answer questions on CEDRS. I've been using it for so long now that I like to help other people. But that is the training website. If you don't want to ask me and you want to look for things, that's where that is. And contact, this is another very useful page that I use fairly often. It just has basically everybody who is a CEDRS user's contact information. So if there is somebody specific you need to try to get a hold of, or a specific hospital, you can typically find it here. So that's hospital contacts, and then here's general communicable disease contacts. So take a look at that. Take a look and make sure your information is correct on there. It's probably a good idea. And then the last one is just the hot topics page, where you can see all the hot topics. These are what get sent out from the state. Tom and I send them out in our weekly CEDRS, but say there's a specific one you want to look at, you can reach it there. And with that, oh, see, it kicked me out. It was too long. With that, I believe that brings me to the end of my CEDRS training. Is there anything I missed or any outstanding questions that anybody has on the phone right now? If you came in late and there's something you missed that you would like me to go over, I'm happy to stay on the line and go over that with you. Just let me know. And if you came in late and didn't already, please enter your name and email and agency into the chat box. That's what I'm using as our roster kind of roll call, so I can get everybody marked off in co-train and just know who all attended. But if there are not any other questions or burning topics, then this will be it. I appreciate everybody staying on the line and going through this CEDRS training with me. I do plan on doing these again in the future as well. So if you need another refresher, there will be another one for you.
That was really helpful.
Andy. Yeah. Hey, Andy, it's Jim.
Yeah.
Hey, yeah, question for, I just want to see if this is a reasonable response. If we had a large local or regional outbreak where public health resources are very limited or strapped, filling out the paper investigation form on multiple patients, and then maybe in an hour or two letting like regional staff in support of public health directors input it into the electronic version, is that reasonable?
Absolutely.
Okay.
Yep. We'd be happy to do that.
Okay.
Yep. I think that's certainly part of our capacity building and, response capacity is doing that sort of thing.
Okay.
So that is completely reasonable to me.
Okay. Thank you.
Yeah. Any other questions from anybody or anything somebody came in late? Going once, going twice. Okay, everybody. Well, thanks a lot for staying on the call. If there's anything you didn't want to bring up on this webinar, feel free to email me or call me. Happy to talk that over. Otherwise, I will end it here, and I hope everybody has a good afternoon. Thanks for joining the webinar.